Assalamu alaikum everyone. I'm Dr. Sayeeda Zurnook, currently working as a registrar in Japan Bangladesh Friendship Hospital under Dr. S.K. Farid Ahmed. Thank you Oncology Club Bangladesh for giving me this opportunity. Today my topic is about the alarming increase in the breast cancer incidence among Bangladeshi population. It's a snapshot from a single center from June 2019 to October 2024. Starting with a brief introduction, as we all know that the breast cancer is the most common cancer in women, but it is the most common cancer overall. So what do we know about the breast cancer? Breast cancer is a disease in which the abnormal breast cells grow out of control and form tumors, and if it is left unchecked, the tumors can spread throughout the body and become fatal. So according to the European Society for Medical Oncology, the breast cancer diagnosis changes the life around 1 in 8 women. But the recent data according to the Breast Cancer Organization UK showed that nowadays it is 1 in 7 women affecting in their lifetime. There are several types of breast cancer, non-invasive breast cancer and the invasive breast cancer. It is the most common one. And there are other several types like invasive lobular breast cancer, inflammatory breast cancer, Paget's disease of the breast, tubular cancer, mucinous cancer, malignant fibrosis, and so on. And interestingly, it doesn't spare men entirely because it represents around 1% of all cases of the breast cancer. And in the last few decades, we observed that the incidence rate in Bangladesh has begun to rise in the age group of 40 to 50 years. In our country, women often do not present for the medical care early enough due to various reasons, such as illiteracy, lack of awareness, financial constraint, and most important is the shyness, like social taboo or cultural background, which discouraging our women for seeking for the further or appropriate medical care. Now, coming to the objective of our study, which seeks to highlight the alarming increase of breast cancer in a single center, breast care unit led by Dr. S.K. Farid Ahmed and his team, that represents the population from all corners of Bangladesh. Now, coming to the materials and methodology, the methodology of our study, the patients with primary breast cancer from June 2019 to October 2024 were identified, and the information on tumor biology grade, nodal status, postoperative histopathology, and metastasis were studied retrospectively. And our data are from sourced from the patient board website, which has the documentation of the patient's history, examination finding, investigations, and treatment. Now, coming to the results and discussion, from June 2019 to October 2024, our total number of patients are 6,682, and among them, the 1,651 patients are diagnosed as a cancer patient, which is about 24.7%. And this 24.7% came to us as a symptomatic patient, not under the screening program. Like some patients came to us with a symptom of breast lump, or some patients came to us as an previously or earlier diagnosed as an breast cancer seeking for further medical care. Now, this is the most important slide of my presentation. This is the graphical representation of the age distribution of cases showing that from 22 to 30 to over 60 years of grade. The data ranges from the youngest group, here you can see that the 22 to 30 to over 60 years. So the most affected group here is the 41 to 50 years. The number of cases is here 530, and in 31 to 40 is 369. So, and after 50 years, we can see that the number of cases gradually declines with 265 cases over 60 years. Interestingly, the 22 to 30 years have the 108 number of cases, which is very much significant figure for this younger population. So this emphasizes the need for early detection and awareness. So in our country, the pattern of breast cancer reveals something fascinating, because if you carefully see that, the graph shows that the case begins to rise from the younger age, then it goes peak at 41 to 50, then it falls after the 50 years. Whereas compared to the Western, after 50 years, the graph doesn't fall, it continues to climb steadily with higher incidence observed in the older age group. So this is the graph that I am talking about. It is the pattern of the breast cancer worldwide and UK trends. I have taken this graph from the Cancer Research UK. If you carefully see that after 50 years, their graph doesn't fall, it's steadily increasing, and higher incidence observed in the older age group. So in the Western countries, the screening programs target the older population, but if we follow the same strategy in our country, then we will lose some of our patients, like in 31 to 50 years, for the late detection. So in our country, it is very much crucial to focus on the younger age group for screening, at least starting as early as 35 years and onwards by annual mammographic screening to effectively address the high prevalence among the middle-aged individual. Now, coming to the histopathology, most commonly found is the invasive ductal carcinoma, which is 97.5%, and only 2.5% found as an invasive lobular carcinoma. And in case of invasive ductal carcinoma, most commonly found is the grade 2 disease on histopathology, which is about 82%, followed by grade 3, which is 9.3%, and grade 1 is about 8.7%. Now, coming to the inflammatory breast cancer, it is the most aggressive form of the breast cancer, which represents about 0.5% to 2% of all cases in the breast cancer of worldwide. Here, patient presented to us in the form of cellulitis and mastitis and often misdiagnosed. But in our center, we found about 134 patients diagnosed as an inflammatory breast cancer. And among them, the youngest one was the 22 years and the eldest one was the 87 years. And there is almost similar lateral to the right and left. So in our center, we found out that the percentage is relatively very high, which is 8.12%. So coming to the tumor biology, out of this 1,651 patients, data on immunohistochemistry was found on 1,120 patients. Rest of our 531 patients did not follow up and their immunohistochemistry was not known. And among these 1,120 patients, about 293 patients diagnosed as a triple negative breast cancer, which is 26.1%, which is high compared to the worldwide incidence. And on the other hand, we found out that estrogen receptor positive found about 827 patients, which is about 73.8%. And HER2 positive was found individually in 13.4% patients. Now, the surgical care that we given to our patients, wide local excisions, including the wire-guided wide local excisions, which was conducted 472 times, whereas mastectomy performed about 302 times. And in case of axillary surgery, the most commonly performed surgery is the level 2 axillary clearance with 415 cases, whereas sentinel lymph node biopsy performed 382 times. This strongly suggests that the patients are presenting at the later stages. If you see that the breast surgery and axillary surgery are not equal, because we performed on 23 patients only the axillary surgery because they came to us as an unplanned lumpectomy and post-operatively they diagnosed as an breast cancer. So to complete the surgical care, we did the only axillary surgery. Now, concluding my speech, there is an increasing trend in incidence of breast cancer in Bangladesh, and young patients are spared. So, cases like inflammatory breast cancer, triple negative breast cancer up to and require further studies. So, our focus should be creating greater awareness, mammographic screening, which should be started at least 35 years and onwards annually, and early diagnosis and adequate treatment, which will have an impact on survival and greater quality of lives. So I hope this presentation has shed light on the growing concern of the breast cancer among the Bangladeshi population and the urgent need for action. Thank you all for your attention today.